Several months ago, we put together what we call a strategic approach to COVID-19 vaccine research and development. And the reason we did this is because there are multiple candidate vaccines that are moving along at a very rapid pace. And we wanted to make sure that they learn from each other. So we made standardized protocols, common data and safety monitoring boards, common primary and secondary endpoints, and common individual laboratory tests. There are 3 separate platforms that are being pursued with government help: nucleic acid, including the mRNA of Moderna, viral vectors such as adenovectors and VSV, and protein subunits. One of these is a trial that started last Monday, this past Monday, the 27th, to beginning in a phase 3 trial. It's a trial that will go over several months involving 30,000 individuals. We hope that as the time we get into the late fall and early winter, we will have, in fact, a vaccine that we can say would be safe and effective. One can never guarantee the safety or effectiveness unless you do the trial, but we are cautiously optimistic that this will be successful, because in the early studies in human, the phase 1 study, it clearly showed that individuals who were vaccinated mounted a neutralizing antibody response that was at least comparable and in many respects better than what we see in convalescent serum from individuals who have recovered from COVID-19. As I mentioned, the phase 3 trial has already started. 30,000 individuals, we are already starting to enroll. I might also conclude, members of the committee, to point out that there is a website called coronaviruspreventionnetwork.org where individuals can actually indicate their willingness to participate in the clinical trials and to make sure that we have a diverse representation. Already, as of last night, there have been over 250,000 individuals who have registered their interest in being in these trials. And I just want to use my last couple of seconds to urge anyone who's listening who wants to participate to please go to that website and register so that you can be part of the solution of this terrible scourge. Thank you, Mr. Chairman.
Dr. Fauci, on March 11th of this year, you testified before the Oversight Committee saying, and I quote, "It's going to get worse." I regret to say you were right. It did get worse. On March 11th, the country had confirmed just over 1,200 cases and 31 deaths. Today, we have confirmed more than 4.4 million cases, and we have just reached 150,000 deaths. There's a chart that I have up here. This chart compares the number of new daily coronavirus cases in the United States with those in Europe. It shows just how much worse the outbreak has been in the United States. Here's Europe, the little line here, the European Union. Here, the United States. And here's where we were on the way. We started going up, while the European countries, European Union, plateaued and is going down. Dr. Fauci, can you help us understand why? While Europe has largely contained the virus, the United States has seen a continued rise in new cases.
Thank you very much, Mr. Chairman. The answer to that question is really somewhat complex, but I'll try maybe to very briefly go through what I believe are at least some of the factors that were involved. If you look at what happened in Europe when they shut down or locked down or went to shelter in place, however you want to describe it, they really did it to the tune of about 95+% of the country did that. When you actually look at what we did, even though we shut down, even though it created a great deal of difficulty, we really functionally shut down only about 50% in the sense of the totality of the country, which means when we reached our peak, as they did, they came down almost to a low baseline, as you've shown very clearly. But take a look at what happened to our baseline. We came up, down, and then we plateaued at about 20,000 cases a day. So we started off with a very difficult baseline of transmission that was going on at the time that we tried to open up the country. And when we opened up the country, what we saw, particularly most recently in the southern states, was an increase of cases to 20, 30, 40, 50, and a couple of weeks ago it was up to 70,000 per day, and now it's down between 50 and 60. And the reasons for that are complex. There were some states that did it very well, and there are some states that did not. And when I say did not, I mean, we put out, as Ranking Member Scalise mentioned, the guidelines of a gateway, phase 1, phase 2, phase 3. Some were followed very carefully and some were not. And in those situations in which it were not, that led to the surging that you're showing on your chart there. And one of the reasons is not doing some of the things that Dr. Redfield mentioned in his opening statement: universal wearing of masks, avoiding crowds, physical distancing, et cetera, et cetera. So it's a complicated reason why those charts are that way, and hopefully, as we're going forward, we can turn those around, and I do believe we can, Mr. Chairman, by doing some of the fundamental things that we're talking about, 5 easy things to do that were mentioned by Dr. Redfield.
When we talk about President Trump's team that he has been relying on to help put together this plan, and like I said, this is just a small part of the plan. There are thousands and thousands of more pages online of various aspects of President Trump's plan to combat the coronavirus. But we have, of course, Dr. Fauci, Dr. Gerard, Dr. Redfield. We see Dr. Birx. There's a whole array of doctors, medical experts, best in the world, that are helping work with President Trump to develop this plan. Is that correct? If I could ask any of y'all, is that correct? By the way, were any of you sidelined from coming here? I know some people try to use that term. I haven't heard of anybody sidelined, but if any of you are sidelined, please share it, because I haven't seen that. Good to see all of you here. Dr. Fauci, let me ask you about some of the decisions that you worked with President Trump on, and the whole team did. I know when you go back to the beginning of this, the China ban was very heavily discussed. Were you involved in working with President Trump on deciding to ban flights from China?
Yes, sir, I was.
Do you agree with that decision?
I do.
Do you think that decision saved lives, Dr. Fauci?
Yes, I do.
Do you agree with the decision when ultimately we saw spread in Europe, and then the president recommended that we extend that to Europe? Did you participate in that discussion?
I was actively involved in that discussion, sir.
Do you agree with that decision?
Yes, I do.
Do you think that decision saved lives?
Yes, I do.
Eventually, then, we saw the United Kingdom have an outbreak, and there had to be a tough decision made. Do we extend that to the United Kingdom? Were you part of that decision?
I was.
And do you agree with that decision as well?
I do.
Did that decision save lives?
Yes, it did.
When you look at the 15 days to slow the spread, initially it started at 15. Were you part of the decision to implement that decision?
I was very much involved in that.
Did that decision save lives, Dr. Fauci?
I believe it did.
Then when President Trump met with you and Dr. Birx to extend that another 30 days, do you agree with that decision that President Trump made to extend that?
Yes, I was very much involved, and I agree with it.
Did that decision save lives, Dr. Fauci?
I believe it did.
So I know we've heard a lot about disagreements. Clearly, there are many decisions made. In fact, there are many very internationally respected doctors that are involved in each of those decisions. Is that correct?
Yes.
By and large, would you say that you and President Trump have been in agreement on most of those decisions?
We were in agreement on virtually all of those.
I appreciate that.
I recall reading one of your reports on AIDS, and you said, "I will never retire until we have a vaccine." We still don't have a vaccine for AIDS. Ebola took 5 years. How realistic is a vaccine? Is it dreaming, or is it a reality? Are the protocols as safe as they possibly could be as we've always had for vaccines? Could you give us an honest assessment of where our country is in vaccine development?
Yeah, it's reality, Congresswoman Maloney. I believe it will occur. I think the difference between HIV and coronavirus is so different that I don't think you compare them, because the body does not make a very good immune response against HIV, so it would make vaccine development very difficult, whereas the body does make a robust immune response against coronavirus, which tells us that I believe that we can get to that goal. I know to some people this seems like it is so fast that there might be compromising of safety and in scientific integrity, and I can tell you that is absolutely not the case. The rapidity with which we're doing it is as a result of very different technologies in getting from the time we recognized this pathogen in the beginning of January to the time we were able to get into a phase 1 trial, to the time we were able to do phase 2, and then, as I mentioned, just this past Monday, we started a phase 3. That was not reckless rushing. That was technology and doing things in a way that does not compromise any of the steps. So I believe that it is realistic, as I mentioned in my opening statement, that the early data from the phase 1 trial shows that this candidate, and I'm sure other candidates will do it also. This is not the only vaccine. There are more than one. There are about a dozen, 5 or 6 that the federal government is actively involved with, is going into phase 3 trials over the next few months, as I mentioned, one of which is already in. The response that was induced was really quite favorable. And as I've said often, and I'll repeat it for the record now, there's never a guarantee that you're going to get a safe and effective vaccine. But from everything we've seen now in the animal data as well as the early human data, we feel cautiously optimistic that we will have a vaccine by the end of this year and as we go into 2021. So I don't think it's dreaming, Congresswoman. I believe it's a reality and will be shown to be a reality.
Dr. Fauci, do protests increase the spread of the virus?
Do protests increase the spread of the virus? I think I can make a general statement.
Well, 500,000 protesters on June 6th alone.
Yeah.
I'm just asking, that number of
No.
people, does it increase the spread of the virus?
Crowding together, particularly when you're not wearing a mask, contributes to the spread of the virus.
Should we limit the protesting?
I'm not sure what you mean. How do we say limit the protesting?
Should government limit the protesting?
I don't think that's relevant to.
Well, you just said if it increases the spread of the virus. I'm just asking, should we limit it?
Well, I'm not in a position to determine what the government can do in a forceful way.
Well, you make all kinds of recommendations. You make comments on dating, on baseball, on everything you can imagine. I'm just asking you, just said that protests increase the spread. I'm just asking you, should we try to limit the protests?
No, I think I would leave that to people who have more of a position to do that. I can tell you.
Government stopping people from going to church, Dr. Fauci?
Yeah.
Last week in the Calvary Chapel case, 5 liberals on the Supreme Court said it was okay for Nevada to limit church services. Justice Gorsuch said it best. He said, there's no world in which the Constitution permits Nevada to favor Caesar's Palace over Calvary Chapel. I'm just asking, is there a world where the Constitution says you can favor one First Amendment liberty, protesting, over another, practicing your faith?
I'm not favoring anybody over anybody. I'm just making a statement that's a broad statement that avoid crowds of any type, no matter where you are, because that leads to the acquisition and transmission. And I don't judge one crowd versus another crowd. When you're in a crowd, particularly if you're not wearing a mask, that induces the spread.
It's a simple question, doctor. Should we limit the protests? Government is obviously limiting people going to church. And look, there's been no violence that I can see at church. I haven't seen people during a church service go out and harm police officers or burn buildings. But we know that, for 63 days, 9 weeks, it's been happening in Portland.
Right. Yeah.
Well, one night in Chicago, 49 officers were injured, but no limit to protests. But boy, you can't go to church on Sunday.
What was the?
I don't know how many times I can answer that. I'm not going to opine on limiting anything. I'm just going to tell you.
You've opined on a lot of things, Dr. Fauci.
Yeah, but I've never said
this is something that
limit
directly impacts the spread of the virus, and I'm asking your position on the protest.
Yeah, I'm not going to opine on limiting anything. I'm telling you what it is, the danger. And you can make your own conclusion about that. You should stay away from crowds, no matter where the crowds are.
Government has stopped people from going to work. In fact, just in New Jersey 4 days ago, Ian Smith, Frank Trombetta were arrested for trying to operate their business, their gym. They were arrested. But my bet is if these 2 individuals who own this gym were outside just in front of their gym, and all the people who were working out in their gym were outside protesting, they'd been just fine. But because they were in the gym working out, actually running their business, they got arrested. You think that's okay?
You know, I'm not going to opine on who gets arrested and who does not. I mean, you get where I'm going. I'm telling you, as a public health official, I say crowds.
Do you see the inconsistency, though, Dr. Fauci?
There's no inconsistency, Congressman.
So you're allowed to protest millions of people on one day in crowds yelling, screaming, but you try to run your business, you get arrested? And if you stood right outside of that same business and protested, you wouldn't get arrested? You don't see an inconsistency there?
I don't understand what you're asking me as a public health official to opine on who should get arrested or not. That's not my position. You could ask it as much as you want,
you've advocated for
and I'm
certain
not gonna
businesses.
answer it.
You've advocated for certain businesses to be shut down. I'm just asking you on your position on the protest. I haven't seen one. We've heard a lot about hair salons. I haven't seen one hairstylist who, between haircuts, goes out and attacks police or sets something on fire. But we've seen all kinds of that stuff during protests, and we know the protest actually increased the spread of the virus. You've said that.
I said crowds. I didn't say specifically. I didn't say protests do anything.
So the protests don't increase the spread of the virus?
I didn't say that. You're putting words in my mouth.
No, I just want an answer to the question. Do the protests increase the spread of the virus?
I don't have any scientific evidence that anything. I can tell you that crowds are known, particularly when you don't have a mask, to increase the acquisition and transmission, no matter what the crowd is.
So you don't have a position on whether the protests increase the spread of the virus or don't increase the spread of the virus?
I'm saying that crowds, wherever the crowds are, can give you an increased probability that there's going to be acquisition and transmission.
But do you understand Americans' concern? Protesting, particularly according to the Democrats, is just fine, but you can't go to work, you can't go to school, you can't go to church. There's limits placed on all three of those fundamental activities, First Amendment activities, but protesting is just fine.
You know,
the gentleman's time has expired, but I'll just ask the gentleman to just think about his question and put it in reference to crowds that gather at political meetings, at fundraisers without masks, on an oil rig in Texas, nobody wearing a mask, nobody social distancing, but a fundraiser.
Right.
Would that be problematic? President Trump has just tweeted out a statement that I'm going to quote in reference to my chart about comparing these cases. He says that the United States has far more cases than Europe, and I'm quoted here, because we do much more testing than any other country in the world. If we had no testing or bad testing, we would show very few cases. Now, Dr. Fauci, do you agree with the President's statement, or do you stand by your previous answer that the difference is caused by multiple factors, including the fact that some states did not do a good job of reopening?
I stand by my previous statement that the increase in cases was due to a number of factors, one of which was that in the attempt to reopen, that in some situations states did not abide strictly by the guidelines that the task force and the White House had put out, and others that even did abide by it, the people in the state actually were congregating in crowds and not wearing masks. I might also just bring something that I thought about and mentioned to you before, Mr. Chairman, that when we talk about crowds and masks, it's always better outdoors than indoors, and being crowds indoors is always worse than crowds outdoors. That's the case because of the circulation of air. So we should avoid crowds under any circumstances, but wearing a mask is the critical issue, right?
I agree with that, and I think that I will go to restaurants who allow me to sit outdoors,
right. Yeah.
And not indoors. So I've been following the science, and I've been agreeing with all three of you as to how we ought to conduct ourselves. But let me just say, and I feel very strongly about this, that the First Amendment to the United States Constitution means a whole lot to me. I'm sitting here as a result of a protest. We open up this meeting today, and many of you, Dr. Redfield most especially, and you, Mr. Ranking Member, talking about our great friend John Lewis, with whom I enjoyed a 60-year relationship. We met protesting, trying to get off the back of the bus, trying to integrate schools, trying to be able to shop in a 5 and 10 cent store and not be arrested for trespassing. Fine for us to get school supplies out of that store, but you can't sit down and eat a hamburger. I'm glad the government did not limit our protests. And so the First Amendment has constraints. The Supreme Court has told us that. You can't yell fire in a crowded theater, but you can peaceably assemble to redress your grievances. You can't do that. Well, I don't think any of those people who were marching out here on this plaza that's now called Black Lives Matter Plaza, they were not carrying guns. They were not disturbing anybody. They were peaceful. They were peaceful. When John Lewis went across that Edmund Pettus Bridge, nobody had any weapons. They were peaceful. They were met by weapons. And so I don't want us to get confused here. And so I'm going to close out my 5 minutes here by asking whether or not this disconnect that seems to be between what the White House is saying publicly and what they're sending out to the states privately. And as we mentioned earlier in the letter, several of these states seem to be reacting to the public statements from the White House and not following the recommendations of the task force that are being sent to them privately. Now, this week, a leaked White House coronavirus task force report paints a very different picture. I've got the document here. This was sent out to the states. And the states in the red zone that are refusing to comply is who heard from us. So I'm not being partisan here. We're trying to save lives. I started my professional career as a public school teacher. I have a daughter who spent 25 years in the classroom. And she's telling me every day how concerned teachers are about returning to school without the safety precautions that so many school districts have asked us to do. That is what my concern is. It's not about going back to school. I know the value of going to school. I know what it is to represent a school district where thousands and thousands of children do not have the internet and cannot receive online learning. I want them in the classroom. I want them to be educated, but I want them safe. And that's what this is about. And I'm not going to ask for an answer to that. I've gone over my time, but I'll yield back. I'll yield.